Hey guys, how are you doing? Welcome back to the channel. So it has been 1 year that I've been living at this place. I have started doing M.Ch last year. I want to share a lot of things with you. I want to share what all happened in my life. What do I have in the plans for the next 2 years? I've noted down some 8 points about which I want to talk about. So all those will be covered in this video. So I have a very minimalistic setup here. I don't have much. I have not started my kitchen yet. I don't cook here. I usually eat in the mess, hostel mess, or I order from Zomato or Swiggy. I just make tea or Maggi or just for emergency food services. And I'm really bad at making tea. I don't know why I'm doing this just to shoot this video. Otherwise, I don't usually make tea for myself. So over a cup of tea, let's just get into talking about how my last year was. If you ask me to describe this year in one word, I would say it was good. Not the best of the years. Obviously, we had a second wave of COVID this year, so we cannot call it a good year. But overall, it was okay for me. I got comfortable in 1 month at my new workplace. The seniors were very helping, and the consultants also, although they are very strict for the academics and patient care. But on a personal level, they realized that we are in a stage where we need to manage our personal as well as professional lives. That way, they are very understanding. And once I got comfortable, it was pretty smooth. I worked in 2 units so far out of the 6 units rotation that we have. My thesis protocol got accepted, that was good, and my patients and follow-up is going as per plan, so I should be able to complete my thesis on time. After I had joined in 3 to 4 months, we had the second wave of COVID, if I'm not wrong, and that was a terrible time. I myself got infected, took me around 2 weeks to recover from it, and that was a terrible experience. Really hope that we do not get another wave of COVID in our country. Then my parents moved to Manesar this year from Hyderabad. They have come to North after a long time, and I also got to spend some time with my parents after a long time. I had been staying away from family for I don't know how long. Last I remember staying with family was in 2014, I think, when I was preparing for my NEET PG exam. So it was good to have a company of my parents for some time this year. This YouTube channel got monetized this year. That was a big achievement, I think, and now from YouTube AdSense money, I'm able to buy myself a breakfast every day. So that's a good start, I think, isn't it? And now let's try to answer a very important question that a lot of you have been asking, that how does it feel to be an M.Ch resident? And this is a tough question actually, because I am 32 years old now. Being a first year resident at a government hospital really slogs your guts out. There is so much paperwork involved. You have to coordinate basic management issues in the hospital. You have to coordinate with the staff and get the work done somehow. A first year resident is the only one who is actually able to coordinate everything. So there is a lot of responsibility on the shoulders of first year, and it is really difficult. Everywhere in India, wherever you go in a medical college, first year in residency is one of the toughest periods, and living that again after first year of MS is really difficult actually. And because I had done 2 years of senior residency before I joined here, and I was used to ordering my junior residents that do this, do that, handle all the paperwork and do whatever I did not like to do. But now I am the first year in M.Ch and I have to do everything. So it gets a little irritating sometimes, but you gotta do what you gotta do. Can't help it. Talking about M.Ch as such, it is a lot of pressure because things cannot be taken lightly at this stage. These are the last few years of learning of a doctor, and after this there is nobody who is going to teach you. You are out by yourself in the crazy world of competition. You have to make your own place after this, and it is a lot of pressure. Things do get serious in second year because the responsibilities increase and we need to pay attention to detail. We are tested about the core understanding of the subject. Cannot leave any stone unturned. So that way M.Ch is a little different from MS. So was plastic surgery the right choice for me? Now this is a question that I've asked myself multiple times this year. Not because I do not like plastic surgery, but because there is so much reading involved, it's crazy. After I finished MS, I brainstormed for a couple of years to decide what I exactly wanted to do with my life. Some people go for fellowships, some people go for M.Ch, some people go for MRCS, and some people go abroad. I did not want to go abroad. I wanted to settle in India, and I did not want to just settle with general surgery because now it is getting very dependent on laparoscopy, and I did not like laparoscopy. So I decided I need to do M.Ch, and which branch should I choose? I was earlier thinking of GI surgery, but then I moved on to plastic. I met a few plastic surgery consultants and teachers, and I decided that plastic surgery will be the right branch for me. And I really enjoyed reading it during the preparation period. So as a subject and for surgery, I absolutely love it. The craft involved is so beautiful. The innovations, the imagination, and the end result of the surgeries that we perform gives you a high that you've never experienced before. The surgical pleasure is at a different level in plastic surgery. There is no doubt about that. The only problem I have is the amount of reading involved. It is just so vast, and the learning is of limitless proportions. There is no end to what you can read in plastic surgery, and that is something I realized after I joined. So the only thing I'm scared about is whether I will be able to read so much or not. So if I manage to read well for 2 years, I'm very sure that I will be a very good plastic surgeon. Now let's get to business and see what all I have learnt, and for that we need to go to the desk. So plastic surgery is a really vast subject and involves a lot of subspecialties. So let's start with the first one, that is burn surgery. Safdarjung Hospital is the largest burn center in our country, so obviously I don't need to say anything more. I'm going to learn everything related to burn surgery in these 3 years. I don't think anywhere else there is better training for burn related surgeries than Safdarjung Hospital. The second one is trauma surgery. Now trauma surgery is primarily handled by general surgery or orthopedics, and whenever a reconstruction is required, then plastic surgeons are called. So limb reconstruction, any kind of wounds that need reconstruction are managed by plastic surgery. I won't go into the details of it, but a lot of trauma cases come to Safdarjung Hospital, so we have a huge caseload of these patients as well. And then is the microvascular surgery. Now this is a very recent development. A lot of microsurgery cases are being done by plastic surgeons. Now we are doing AV fistula as well. We are repairing the nerves, arteries and veins. We are doing free flaps. We are doing a lot of microvascular reconstruction. And in the last 1 year, I did get exposed to a lot of such cases as well. Then is brachial plexus surgery. Now I'm doing my thesis on brachial plexus surgery, so obviously I will have a lot of exposure to brachial plexus. Now this is something which is not done everywhere. You will find very few hospitals who are actually operating on brachial plexus patients. So that is a really good thing, and since it is my thesis, I am getting a lot of exposure. Then there is hand surgery. As first years, we mainly handle the emergency hand cases. The elective cases are done mostly by the seniors in the elective OT. Amputations, tendon injuries, nerve injuries, arterial injuries, all things I have done in the past 1 year. So yeah. Now coming to cosmetic surgery, patients who wish for a cosmetic surgery usually go to the private setup because so the government setup does not have so much exposure to cosmetic surgery per se, but since now we are in the times of Instagram and YouTube and everybody wants to get some kind of a cosmetic correction, we do get some cases who want rhinoplasties, some scar corrections, some liposuction cases, and all those things we have done in Safdarjung Hospital as well. Then is oncosurgery reconstruction. These surgeries require two teams. One is the oncosurgery team and then is the plastic surgery team. Oncosurgeon will remove your tumor. The plastic surgeon will reconstruct what they have removed. These are very elaborate and long surgeries, take 8 to 10 hours. I have been a part of few such surgeries and it is always a team effort, so I won't go into the detail of it. Then is cleft and craniofacial surgery. Now cleft lip, cleft palate, these are like the forte of plastic surgeons. Every day these cases are being operated. We get a lot of exposure of such cases. Craniofacial surgeries are relatively less common because these are critical cases. Patients require ICU care sometimes, and mortality is also associated with these cases. So not every surgeon will put their hands on such cases, but I have been lucky to have been a part of such surgeries as well in the past 6 months. Body contouring, again, these are more common in the private setup and less common in the government setup. So this was just an overview of the types of patient that I have seen in the last 1 year. And if COVID stays silent for some time, I am sure I'll have a very good hands-on of many more cases. And talking about life in Delhi, I moved here from Chandigarh. Both the cities are poles apart. Life in Delhi is fast. Everybody seems to be in a hurry here. I would describe Delhi as a chaotic mess of ambitious people who are trying to make the most of their lives. The worst things about Delhi are obviously traffic and pollution. Everybody knows that. The traffic is the worst. You cannot drive in Delhi. It's really frustrating. So I mostly take the metro to commute, and for work I go by a two-wheeler. Then pollution is the worst. The air quality index is one of the worst in the world. You cannot go out in Delhi without wearing a mask, even without COVID. The best thing about Delhi is the food, I think. From roadside thelas to the most luxurious dining experience, Delhi has it all. And there is no limit to the number of places you can explore to have good food. And then there are so many historic places to visit. So I think Delhi is an Instagrammer's delight, if you say so. So me and Sukriti first met in 2008. It has been a long time. We know each other pretty well. That is the reason I think we are able to manage a long distance relationship at present. It is tough actually for both of us. At this age, we do feel the need for a companion when we come back from work. But thankfully, we live in the era of video calls. Otherwise, we would have been writing letters to each other every week, expressing our feelings. We try to meet each other every fortnight at least, if not weekly. Either I go to Chandigarh or she comes to Delhi. And this traveling during our off days does get a little tiring, but I think it is a small ask to keep our relationship in high spirits. We both currently are in the most important phase of our careers, so we are currently concentrating on that. And to describe our situation, I had written a poem on this. I had posted it on Instagram a few days back, which said, "दूर होके भी पास हो तुम, हर पल साथ चलता एक एहसास हो तुम, जब सपने हो दोनों के ज़रूरी, कुछ वक्त सह लेंगे ये दूरी." So that's how it is. Now coming to the big question that how I'm managing this YouTube channel along with all the studying and all the work. See, when I joined in December last year, that was the time my channel suddenly picked up. I was not expecting it to grow as it did. It started getting a lot of subscribers, a lot of views, and then I was forced to keep this channel going. Earlier I was just doing it as a hobby, but then it grew so much that I thought that I have something that I can build on. I have posted around 21 videos last year, which is not even close to what YouTube expects you to make, and it's not ideal for the channel growth, but somehow it's still going, and these 21 videos did manage to keep the channel running. So I'm frankly not getting enough time to make YouTube videos, and obviously this is not my primary job. I'm just a part-time YouTuber. I am here to be a doctor, I'm here to be a plastic surgeon, and that is what my primary aim is. YouTube I'm doing just as a hobby, and if it's getting me some money, then what's the harm in that? So for the next couple of years as well, I will not be able to devote much time to this channel because I have my studying to do, I have my thesis, I have the work, I have to take care of the patients. So I don't get time to just sit and make a video. Now this video that I'm shooting today is going to take almost a whole day. That's why my frequency of uploading has reduced, but it's a good time pass and I like doing it. So let's see how it goes. So I have a couple of years left here, and I have to read as much as possible. I have to learn as much plastic surgery as possible in these couple of years, because after this I am all on my own. No, there will be nobody to teach me after these couple of years. So this is the most important time of my life. I need to first complete my thesis and publish my thesis. Then I need to prepare for my final exams, which is in itself a big mountain to climb. So I have a lot of work to do. So yeah, that's all about this year and my future plans. It has been a good year, and I hope the next year is also good and without any COVID wave. Being disease free and healthy is the biggest blessing you can have at current times, and I'm really happy that my body is currently able to cope up with all the physical and mental stress. So really looking forward to the next couple of years. Wishing you all a very happy new year. My name is Chisel. You are watching The Tech Doctor. Namaste.